Infection Control Correspondent Mona Hapley here with HCH TV. Cloth-based coverings, physical distancing, and wiping down workstations. By now, these have all become the new normal. But that doesn't mean they're easy to remember, comfortable, or even fun. However, they are important, especially as we prepare to return to the clinic. That's why I have with me my fellow correspondents here to discuss all things infection control. First up, we have Dr. Adrienne Trustman joining us from her office at Fallsway. Dr. Trustman?
So thanks, Mona, for having me on. I'm excited to be here to talk about masks and keeping our coworkers safe. Wearing masks works. It protects us and it protects our clients, even when we're not having symptoms and even when they're not having symptoms. I think the evidence is also pretty conclusive that wearing masks is totally miserable, and particularly as it gets hotter, but that doesn't make it any less important. It's all the more important to keep wearing masks, particularly as we don't know how things are going to change with coronavirus. Washing our hands is just as important as it always has been. It does take 20 seconds to wash your hands effectively, and hand sanitizer is a good alternative if you can't wash your hands.
Well, thank you, Dr. Trustman. Now over to our face covering correspondent, Jeremy Gibbons. Jeremy?
This is face covering correspondent Jeremy Gibbons, live on the scene of my living room to tell you about the importance of wearing face coverings. Everyone reporting to a healthcare for the homeless clinic, including you, must wear a mask at all times when not alone in a room with the door closed or alone in an enclosed cubicle. In the lunchroom, wear a mask. When we talk, wear a mask. When we sing, wear a mask. Tapping into a co-worker's cubicle, wear a mask. This protects us all from the transmission of COVID-19. When we sneeze or even breathe, we produce small droplets of fluid that can transmit COVID-19 into someone else's respiratory system. You can feel great and still be carrying COVID-19. But as I always say, wearing is carrying. What's that? It looks like our in the field social distancing correspondent has just joined us.
Thanks so much as always, Jeremy. Lillian Amaya here with the lowdown on social distancing. Staying 6 feet away from your coworker can be tough, but we know it's the right thing to do. So, who has to social distance? According to my sources, everyone. When in doubt, keep your distance, even if you're wearing a cloth face covering. And yes, this even includes lunch areas. Now, over to our What to Wipe Down segment with correspondent Kristen.
Tristan Roberts here to give you the rhymes and reasons of wiping down workstations. Let's start with who? Case management, psychiatry, behavioral health, anyone who doesn't have a room to themselves. Add yourself to the list if you're in a flex space. Wipe conference rooms too, so you leave no trace. And now to the what? Your table and chairs and that favorite blue pen. All parts of the phone, your mouse, and then anything you've touched that's laying around. When in doubt, just wipe it down. And finally now I'll get to the when. Wipe down before use and then after again. Do this when you come in and when you leave for the night. Follow these guidelines and there will be no virus in sight. This has been What to Wipe Down with Tristan. Now back to you, Mona.
Thanks, Tristan. And there you have it. Wear your face coverings, social distance, keep your workstations cleaned, cough and sneeze into your elbow, wash your hands for 20 seconds. And remember, we're in this together. We're counting on you to help keep COVID-19 under control. Until next time, this is HCH TV, and I am Mona, signing off.